Hi there, my name is Dr. Theodore Kramer and I'm here today for Virtual Visits with Dr. Ted. This is a video series where I talk to new parents about what to expect at each well child check for the first year of life. Virtual Visits with Dr. Ted features baby Harrison, my 2-month-old baby, who you will get to meet during the physical exam part of today's visit. So, first, a little bit about myself if you haven't seen the other videos or met me before. My name is Dr. Kramer. My first name is Ted, so many of my patients call me Dr. Ted. You can call me whatever you like. I've been working with the primary care group that I am with now for 2.5 years now. Before that, I worked at St. Louis Children's Hospital. I worked there for 3 years. I worked in the ER, the ICUs, and the floors. I did my residency at St. Louis Children's Hospital and Washington University here in St. Louis. I did my medical school at SLU. I'm actually from the St. Louis area, and even though I look very young, I am 32 and have a happy baby and an amazing wife. So moving onward, today we're going to go ahead and talk about the 2-month-old visit. Again, I did also want to let you know before we get started, I have 2 office locations, one in the North County region of St. Louis and one in the St. Charles area. So 2 office locations. If you have any questions or you want to be a new patient, give us a call. The same phone number works for both locations. It's 314-838-7912. Again, that's 314-838-7912. So we're going to go ahead and get started at the 2-month visit. So the first thing, whenever a parent walks into the room or whenever I walk into the room with a 2-month-old child, I always ask, are there any big concerns today? So first thing we talk about are parental concerns. If you have any questions, this is the time to ask. There's no such thing as stupid questions, so you can always ask anything that you would like. After we talk about new concerns for today, we then always discuss past medical problems. So if there are any medical problems that we talked about at the newborn visit or at the 2-week-old visit, then we would rediscuss those now, see how they're going, and talk about what we can do to help them improve even more if they're not completely resolved. So those would be the first 2 things we talk about. Next, we would talk a little bit about feeding. Feeding is important at every visit when we're going through the history. So at this age, babies should be taking exclusively formula or breast milk. They should not introduce any other foods or any other liquids at this point in time. No water, no juices, no honey until a year of age, no rice cereal yet either. At this time, just formula or breast milk. If the baby is breastfed, congratulations, keep up the good work, that's wonderful. Breastfeeding at this age should be about every 3 to 4 hours during the day and hopefully a little longer at night, but every 3 to 4 hours during the day. And for those formula-fed babies, we expect 4 to 5 ounces every 3 to 4 hours during the day, and again, longer at night. We talk about, if you were formula fed, we would talk about what type of formula you're on, how it was going. So that is feeding. Along with feeding, we talk about vitamin D. All babies at 2 months of age should be getting some supplemental vitamin D. It's really important for breastfed babies because there's minimal vitamin D in breast milk, definitely not enough. We need 200 international units of that vitamin D per day for strong bones to prevent a disease called rickets, which is soft bones that causes some bowed legs, some other problems as well. So 200 international units of vitamin D, you can get that with D-Visol or Polyvisol with iron. The difference between that, the D-Visol is just the vitamin D drops. Polyvisol with iron is like a multivitamin drop with iron because a lot of babies don't get enough iron. So we give baby Harrison Polyvisol with iron drops. Sometimes it's hard to remember to do that every day, especially if you're waking up every 3 to 4 hours, even at nighttime. It's kind of, sometimes the days blur together. Did we give him the drops today? Did we not? Well, what my wife and I decided to do was print out a little calendar where we could check off each day that we actually gave him that. And those vitamin drops, you can put them straight in the mouth or you can add them to formula. But the vitamin D drops are really important. Even for formula-fed babies, there's not enough vitamin D in the formula until they get 32 ounces of formula in a day. And at this age, they're probably not getting quite 32 ounces of formula a day, so we should still be doing vitamin D drops for all babies at this age. Next, after we talk about feeding, we'll take a look at the weight. Weight should be increasing. A baby's birth weight usually doubles by 5 months of age, so we shouldn't be doubled yet. Usually at this age, they gain about an ounce a day, usually 5 to 7 ounces in a week. So we just want to make sure that they're on track, they're growing like they should be. The head circumference should be getting bigger, but not too big too fast. We'll take a close look at that to make sure it's growing normally. And we'll take a look at the length too. Note that length is not as good of a measure as weight. So as pediatricians, we really focus on the weight more than we do the length. After that, we'll talk about, along with feeding, we'll talk about spit up. It is normal for babies to spit up often. Often they drool while they're taking their bottle or while they're breastfeeding. That's normal. Often they spit up after feeding, or just throughout the day. They can spit up anytime, any place. The big thing is spit up is normal. The reason is because there's a tube that goes from the mouth down to the stomach called the esophagus. At the very bottom of that tube, right above the stomach, there's a circular muscle like this that's supposed to squeeze down in adults to keep the food in the stomach and not coming back up. Well, in babies, that muscle just isn't strong yet. It doesn't really work, so it's like an open tube from the mouth to the stomach. So because of that, spit up is normal. The big thing that we're going to check at 2 months of age is to make sure that spit up is normal. So what is normal spit up? It's either clear or white. It is either liquidy or chunky. And we want to make sure that it isn't shooting across the room, okay? So no projectile spit up, no blood in the spit up, no green color in the spit up. But if it's not shooting across the room, there's no green color, and there's no blood in it, that's normal spit up. Some parents tell me that their baby spits up every day with every feeding, and they think it's the same amount that the baby fed. But as long as the baby's gaining weight, that means they're getting enough formula to continue to grow. So that's one thing that we'll keep a close eye on if there's lots of spit up, is to make sure the baby's still growing, okay? After that, we talk about bowel movements, wet and dirty diapers. So for bowel movements at this age, they should still be soft. They should be, and the consistency of that could be from a runny mustard to a mashed potato to a peanut butter consistency. So peanut butter, a little firmer but spreadable, still soft. We want it to be soft. The color of it should be yellow, green, or brown, or in that spectrum, those colors mixed together. What we don't want to see is blood in the stool, and we don't want to see white or gray in this stool. Number of bowel movements can vary a lot. Many babies have multiple bowel movements a day, and that's completely normal. Many babies go multiple days without a bowel movement, and that is completely normal too. The babies are just absorbing all those nutrients, and that's why they're not having as many bowel movements. If we as adults went multiple days without a bowel movement, it would probably be painful. But no, it can be normal for babies to go up to a week without a bowel movement, as long as it's not painful for them, as long as it's not hard to push out, as long as there's no blood in the stool. Sometimes up to a week can be normal. If you're worried, if it's going multiple days and you're worried, bring your baby in to see us. We'd be happy to take a look to make sure nothing else is going on. In terms of wet diapers, we want to see at least 3 wet diapers a day. That's just making sure that they're getting enough in, that they're well hydrated. So 3 wet diapers a day. Most babies will have way more than that. Baby Harrison will have 3 wet diapers probably in a few hours. He often pees twice right in a row, and that can be normal too. Don't worry at this age if you think your baby's peeing too much. A baby will pee a lot at this age, and they're not peeing too much. In terms of sleep is really, really, really important. Safe sleep. We want the baby to be on their back in their own crib or bassinet, not in the bed with mom, in their own crib or bassinet. At 2 months is usually when you switch from the swaddle to the sleep sack. But the big thing is on their back in their own crib or bassinet. This is so important. And no other sheets, no other stuffed animals, nothing else in the crib or bassinet. Just the baby, the sleep sack or swaddle, and on their back. So that's the ABCs of safe sleep, if you've heard of that. The A stands for alone, B stands for on their back, and C stands for in a crib, but bassinet's fine too. So those are really, really important. Each year, I don't like scaring parents, but this is really, really, really important. Each year, about 3,500 babies die from unsafe sleep. And so we don't want this to be your baby. I know sometimes it's really, really, really hard to get your baby to sleep on their own. It's really, really hard to put them down and have them cry. But so important, because babies do die from sleeping in their beds with mom. Babies do die from sleeping on their stomach. And so we just want to make sure your baby's safe. That's the only reason we bring it up, okay? A big thing about sleep, now is a good age for you to try to put your baby down drowsy but awake. When you can tell their eyes are starting to close, they're starting to get tired, maybe yawning a little bit, put them down drowsy but awake, so they learn to fall asleep on that hard, firm surface instead of just learning to fall asleep in your arms. If they're trained to only fall asleep in your arms, that will make things a lot difficult as they continue to age. It will make it hard for them to learn to sleep through the night, and it will make that hard too when they get older and are able to walk, and they're still wanting to fall asleep in your arms. So just know that sometimes they can fall asleep in your arms, but also sometimes you want to put them down drowsy but awake. Okay, that's so important. Tough to do, but really, really important. So find a few nap times during the day where you can try that out. In regards to safety at 2 months of age, a few things that you should know. Continue to do the rear-facing car seat. Rear-facing is so important. I know parents don't like it because they can't see the baby. There are mirrors you can get so you can see the baby. The reason why they need to be rear-facing is because think of a baby's head. The size of a baby's head compared to their body is much bigger than the size of an adult's head compared to their body. And if you imagine a baby's frontward facing and you get in a car accident, what's going to happen is that big head is going to shoot forward. If they were forward facing in a car accident, and if they shot forward, they often get neck injuries, very, very severe neck injuries. So if you turn them around and face them backwards, their head's up against the seat, and they're going backwards, and then you get in a car accident, their head just goes against that seat and there's no neck injury. So rear facing until age 2 is really, really important. I know it's not fun for parents, but it's really, really important for their safety because car accidents is another way that children do get injured. Avoiding sun exposure at this age is also important. 15 minutes or less I think is okay, but if they're going to be out longer than that, make sure you put a shade over them. The hot water heater thermostat, you want to go ahead and set that to 120 degrees or less. So if you have a hot water heater that you can adjust the thermostat, do 120 or less. It's still going to be hot enough for you to take a good warm shower, but it's not going to burn your baby on accident. The other thing that you can do is some of those forehead thermometers, you can point towards the water and check the temperature of the bath water before you put the baby into. But also, if you touch it, you can tell if it's too hot. The big thing is, at this age, babies really just like room temperature water or maybe very lukewarm, so it does not need to be warm. So the thing that I would say is just try to do room temperature water, but just make sure it's not too hot. Don't smoke. If you do smoke, I know it's not easy to quit. If you do smoke, the safest way to do it is make sure that you go outside to smoke. You wear a jacket. And then when you come back inside, you take that jacket off and leave it in the garage or leave it somewhere outside because the smoke can stay on those jackets too. But again, if you do smoke and you want to quit, talk to your primary care doctor, your adult primary care doctor, because there are ways that adult primary care doctors can help you quit smoking. One thing that I know all parents probably know, but as pediatricians we have to talk about, even though it's no fun to talk about, is never shake a baby. We know that it can be frustrating to be a parent. It can be frustrating when a baby's crying and crying and crying and you don't know why and you think you've tried everything. The big thing is if you do get frustrated, it's okay to leave your baby in their crib or bassinet, leave their baby in a safe place, walk away for 10 or 15 minutes, calm down and come back. So you know that is okay. We know that all parents do get frustrated at times. That's completely normal. We just want your baby to be safe. Another thing that we say is really important, I know it's a little early for this, but no walkers. The reason is because so many babies have gone downstairs in walkers, so many babies have gotten injured in walkers, and walkers don't actually teach babies how to walk. If you already have one and you really, really want to use it, I think it can be okay. You just really have to make sure they're not going to go downstairs and know that it's not going to teach them how to walk. But the American Academy of Pediatrics does not recommend them. And then the last one is that the baby's immune system still isn't ready until they're 3 months old. So we really want to avoid large crowds. All visitors who come over, try to limit it to small groups, close family, close friends. Make sure that they all wash their hands before they hold the baby. Make sure they're all wearing masks before they hold the baby prior to 3 months. And then if they have any symptoms at all, any runny nose, sneezing, even if they think it's allergies, it's probably best for them not to come over at that time. After we talk about safety, that's kind of the last big safety point that I talk about at this age. Well, I really talk to the mom. It's tough. It's tough to be a new mom. Not only did you just give birth, but now you are feeding every 3 hours, waking up multiple times throughout the night. Each one of these feeds can last an hour or so, and you're doing that multiple times a night. You're exhausted. It can be tough. So we really just check in with parents to see how they're doing. We just want to make sure they're doing okay, make sure their mental health is going all right. because postpartum depression, postpartum sadness is a real thing. And if you need help, we have resources to help. There's group therapies, there's counselors, there's therapists, there's a lot out there, and we can get you in touch with whatever service is going to be best for you. So we will touch base just to make sure mom's doing okay. We'll give you a questionnaire as well to fill out called the Edinburgh Questionnaire about postpartum depression. Next, my favorite part, developmental milestones, is the baby doing what a 2-month-old baby should be doing. I think this is a lot of fun. So the first one is, does your baby smile back at you? That's my favorite one. Smiling back. And it doesn't have to be all the time, but every once in a while when you smile at your baby, you should see them smile back. That is the first developmental milestone that we're looking for at this age. Also at 2 months, the baby should coo and vocalize, make those oohs and ahs noise. So coo and vocalizing. And again, if you have a question about what exactly is a coo or what's an ooh or an ah, does this count? Let us know. We'll be happy to talk to you about that. They should sometimes bring their hands together toward midline, not always have them out to the side. So sometimes you just see the hands towards the midline. The next thing is they should follow you to midline and then sometimes a little bit past it by 2 months. So what you should do is if the baby's in their seat or swing and you walk across the room, you should see them follow you. Or in someone else's arms and somebody else is walking through the room, they should follow you past midline. They should be able to hold on to something, whether that's a finger, a rattle, a toy. They should be able to hold on to it. It doesn't have to be for very long, but at least for a short period of time, they should be able to hold on to something. They should start to hold up their head a little steadier. Not 100% perfect, but they should hold it up for a while, and every once in a while you might see a bob down, but pretty much it's getting a lot steadier at this age. If you do tummy time, not only should they be able to hold their head up for a few seconds, but they should also be able to push their chest up a little. So usually it's more like this, where they just are up off their chest just a tiny bit on their elbows. But you should be able to see that as well. And if you hold them by their midsection up on the table, they should push down with their feet. And so kind of push up, bear weight on the legs is what we call that. And the last thing is when babies are first born, they often have their fist clenched most of the time. But by 2 months of age, they should open up those hands more often. So you should at least see them open every once in a while. They still have them fisted often, but they should be able to open their hands up and no longer have them fist clenched all the time. So those are some of the big things that we'll talk about with the history. Another thing is we're going to talk about the vaccine. So at the 2 month visit is the first set of vaccines. The baby did get that first hepatitis B shot, probably at the hospital, maybe at that first visit. But today is the 2 month vaccines. The nice thing about the 2 month vaccines is they've actually combined a whole bunch of shots into one, where when we were children, we got these all separately, okay? So there's 3 shots and 1 drop in the mouth that the baby will get today. But that's still much better than it used to be. So the first shot is actually called Pentosil. It covers 5 different illnesses, which is really great. They took 5 different vaccines and put it all into one. We hope they continue to do that. We hope they make it so it's only 1 shot at each visit. And hopefully down the line it will be like that, but it's not quite there yet. But the nice thing is Pentosil. So what 5 are in Pentosil? Well, the first one is the DTaP. So D is for diphtheria. Diphtheria is a sore throat infection that causes the throat to swell up all the way closed, and then people cannot breathe and they die from it. We haven't seen this for over 20 years in the United States because this vaccine works so good, but still so important because we don't want anyone to die from it. Next one is tetanus. Tetanus can cause lockjaw in adults. It can cause botulism in babies. This is the reason why babies can't eat honey before a year of age. Adults get a tetanus booster every 10 years or sooner if they step on a nail or another metal object. So tetanus, really, really important too. And then acellular pertussis is the next one, the third one in the Pentosil. Acellular pertussis is also known as whooping cough. This is where babies cough, 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 cough so much that they can't breathe. And babies will stop breathing from this, and babies do die from whooping cough. When I worked at St. Louis Children's Hospital, I took care of 3 separate patients who all were admitted with whooping cough. They did need to be hospitalized for several days. They all had great outcomes, but they did need to be in the hospital. So really very, very important vaccine. And most of you, probably your OBGYNs talked to you about making sure that you got this vaccine as well. Also important to have family members to get this vaccine because the babies don't get it until 2 months and the series isn't completely done until 6 months. The next one in there is Haemophilus influenza B. Haemophilus influenza B is one of the germs that can cause ear infections, one of the germs that can cause pneumonias. Of course, there's lots of different germs that cause ear infections and pneumonias, but it does decrease the amount of ear infections and pneumonias. And then the last one in that Penticil is polio. And we haven't seen polio in the United States for a very long time because vaccines work. So that's Penticil. That's 5 in 1. We wish that we could just put them all into one so you just get one shot. The next one is going to be the pneumonia shot. So important. People die from pneumonia often. Really important. And then the last one is the second hepatitis B vaccine. Hepatitis B prevents an infection of the liver, and it's so important. So those are the 3 shots for today. And then there's one drop in the mouth that's actually a vaccine as well. It's called rotavirus. It prevents a diarrhea illness that causes diarrhea and vomiting. And babies used to get this very commonly and have so much vomiting and diarrhea that they would end up in the hospital for IV fluids. This has really decreased the hospitalization rate for rotavirus, and it's really just a drop in the mouth. It's a really great vaccine. All of these vaccines, baby Harrison did get. He had his 2-month visit last Monday, and they're all safe and effective, and I give them to my child. That's how safe I believe they are. Next, and the last thing to talk about for the history is when to call our office. Same thing that we talked about at the 2-week visit. Call our office for fever greater than 100.4, 2 poor feedings in a row, just won't take anything twice in a row, less than 3 wet diapers in a day, that projectile vomiting that shoots across the room, difficulty breathing, or any other concerns at all. So that is all the questions and all the things that we talk about on our history. I'm going to go ahead and grab baby Harrison, and we're going to go ahead and do our exam, and we'll go from there. Hold on one second, and I'll... Hi there, Dr. Kramer again here with baby Harrison for our exam. We'll see how fussy he gets today, but we're going to go head to toe and go ahead and go through the normal 2-month exam, okay? So here we go. Set baby Harrison here. So the first thing I'm going to do is feel for the soft spot on the head. There's one here, one on the back. We're going to use the ophthalmoscope to take a look at the eyes. We're looking for red reflexes. I'm going to use our otoscope here to take a look at the baby's ear. I usually try to start the exam in the mom's arm because they're often upset when we set them down on the table, especially when they don't have clothes on. Say baby Harrison's doing a great job here. So that ear looks great. And go ahead and take a look at the other ear. I'd save the throat to look at the last. I do feel the neck and the clavicles. Take a look at the face for any rashes. Make sure they don't have eczema, which is a fine rash that's sometimes on the face. Baby Harrison does have a little rash around his mouth from drooling today. Just a little Vaseline can help that get better. Take a look at his hands and his arms. Feel the chest tissue. Feel the belly. We're going to listen to his heart and lungs. So that's a little bit of a cooing there for you, just so you know what cooing sounds like. He's getting a little upset here, so hopefully he won't get too fussy for us. Feel the belly. Make sure there's no big liver, no big spleen. Make sure we don't feel what we call a palpable olive by the stomach for babies who are vomiting a lot. We're going to go ahead and take the diaper down. I'm not going to take the diaper off today, but a few things that we would look for under the diaper. For boys, we want to make sure the testes are descended. We want to make sure the circumcision's healing well. If they're a circumcised boy, we feel for the pulses, the inguinal pulses, which are here and here, to make sure they're equal on both sides for both boys and girls. Girls, we take a look just to make sure everything's normal as well. We do then check the hips. So the hips, we do Ortolani and Barlow. For Ortolani, we push down. Barlow, we pull up. This is a ball and cup joint in the hip, and we want to make sure that cup and ball are actually in place, not outside of place. So that's what that does. We feel the toes to make sure they have a normal, what we call plantar response, or Babinski response. We want to just lift up on his shoulders here a little and let go, and his arms should go up and out. We'll try again. Yeah, he's not doing it too much today, but he definitely has a normal one. There we go, up and out. We'll take a look at his back, feel along his spine, head to toe. We'll take a look at all of his skin too. Look for any birthmarks or bruises. We're going to pull the back of his diaper down a little bit and make sure that the bottom looks normal too. And then the last thing we're going to do, I don't have a tongue depressor today, but we would bring his mouth down and go ahead and shine a light in there and look at the back of his throat, okay? So head to toe, that's what we're looking for. His exam is normal today. He's starting to get a little fussy, so we're going to go ahead and get him dressed up and ready to go. And then while we're doing that, while you're getting him dressed up, the doctor will be outside getting his paperwork ready, and then I'll be back in just a second to go over the paperwork for the 2-month visit. But that's the exam here today, head to toe. We're going to look at every little part and make sure everything's normal. If you have questions or concerns, let us know. Hi there, this is Dr. Kramer again. Now that we just saw the star of our show, Baby Harrison, and got his exam all done, I'm back to go over the discharge paperwork with you. I'm going to come a little closer so you can take a look. So this is Baby Harrison's discharge paperwork here for you today from his 2-month visit. Up here, again, this is all for the 2-month visit right here. This shows his vitals, height, weight, and all of the other vitals for today, which are all normal. It goes over the immunizations that he got today. Some information about side effects. Again, side effects are rare at this age for these vaccines. If you do notice a low-grade fever, there's definitely sometimes some fussiness or soreness at the site. But most commonly, babies just sleep a lot the day they get their vaccines. So you might expect a little bit more sleepiness. If they have any additional side effects, any rashes or any other problems, definitely give our office a call, but that's super, super rare. So some information about vaccine side effects are here. The next thing on here is that the dose for Tylenol is on here. Most babies do not need Tylenol after vaccinations, but if you want to give a dose of Tylenol, it is okay if they have fever or extreme fussiness. I would say then it would be okay to give one. But if they're doing well, it's not necessary at all. Next section here talks about that vitamin D. Make sure you're giving those vitamin D, whether that's the D-Visol or the Polyvisol with iron. Either of those are fine. The next visit's going to be at 4 months of age. So that's really, really important as well to make sure you schedule that on your way out for the next visit. Next, we got some information here about nutrition. The big thing is that breastfed babies should feed about every 3 hours, longer at night. Bottle-fed babies at this age usually take 4 to 5 ounces per feed during the 2nd month, but that can increase to 5 to 6 ounces by 4 months of age. The big thing is how many total ounces they get per day is more important than how much and how often, and they should be getting 24 to 36 ounces per day, okay? So that's really, really important. We don't recommend microwaving bottles because it can cause heating unevenly throughout the bottle and can sometimes burn the babies. Babies fed cereal do not sleep longer at night, so don't do cereal at this age. It's not safe to do anything but formula or breast milk until 4 months of age. It's actually best to wait till 6 months, but definitely not safe before 4 months. So no water, no juice, no honey until a year of age, no rice cereal, nothing but formula or breast milk until a year. Don't prop the bottle. So propping the bottle is where you put it in the baby's mouth and just lean it up against something and walk away. That is not good for their teeth, and that's not good for their nutrition. Fevers before 3 months of age, fever is a big deal. After 3 months of age, fever is not that big of a deal. That's their body's immune system fighting off an infection. But before 3 months of age, if your baby has a fever, we need to know right away, okay? After 3 months of age, if they're extremely fussy, hard to wake up, not feeding well, having trouble breathing, or having a rash, then we need to know. But again, before 3 months of age, that immune system's not ready for every fever. We need to know right away, okay? That's so important. Stuffy nose and congestions is normal at this age. Humidifier can sometimes help. Sneezing is also normal. It's not a sign of allergies. It's not a sign of infection most of the time. Sleep, we talked about safe sleep already. Make sure you follow the ABCs of safe sleep. Sleep training, again, at this age, what you're going to want to do is put them down drowsy but awake at least once every day or every other day. Put them down drowsy but awake so that they can learn to fall asleep on their own. Those are the big things to know. Other things to know is cuddle your baby, read to your baby, sing with your baby. You cannot spoil a baby at this age. All of those things build brain connections and help them with development. So you cannot spoil a baby. All of those things help them develop. That's all the information that I have for you today. If you have any other questions or concerns, let us know. We'd be happy to go over or talk with you about anything that you would like to discuss. Give our office a call if you're a new patient looking for a doctor. Or if you're a current patient who has any questions at all, let us know. We're there for you. There's no such thing as stupid questions at Dr. Kramer's office. So definitely give us a call. Again, it was good talking to you today. Thanks for listening to the video, and hope you learned something new. If you need us, give us a call at 314-838-7912. Again, that's 314-838-7912. Have a great day. Bye.